Hello everyone, I am David Matute and I will to talk about emphysematous cystitis. Well, with definition, we have cystitis. It's the medical term for inflammation of the bladder. Most of the time, the inflammation is caused by a bacterial infection that is called a urinary infection. Urinary tract infections are a common infection that occur when bacteria, often from the skin or rectum, enter the urethra and infect the urinary tract. Infections can be affect various parts of the urinary tract, but the most common type is the bladder infection, that is called cystitis. Emphysematous cystitis (EC) is a rare form of complicated urinary tract infection, which is a characteristic feature-veined gas within the bladder wall and lumen. The predisposing risk factors of this condition include an older age and female gender. Now, we have a video.
The symptoms for cystitis are of pain, stinging or burning when someone is trying to pass urine. They may also feel like they need to pass urine much more frequently, but only pass small amounts. They may also have a pain in their stomach just above the pubic bone, and they may notice that their urine is cloudy or foul smelling. The advice for someone with cystitis would be to drink lots of water and to take some ibuprofen or paracetamol for the pain or if you have any fever. Some patients with mild symptoms might get away with no treatment at all, but for patients with severe or moderate symptoms, they probably will need some antibiotics. If you do develop a high fever or pain in your loin, you probably do need to seek medical attention, as sometimes it can lead to pyelonephritis, which is an infection within the kidney. The outcome for most patients with an uncomplicated bladder infection is that they will feel better within a week or so. Sometimes it can go up into the kidneys, and at that point you would have pyelonephritis and will need further treatment.
Now, with an application in medicine, we have the clinical signs of the EC are highly variable, ranging from asymptomatic to several sepsis. The most common symptom is the abdominal pain, occurring in the 80% of the patients. Gross hematuria is also common in the 60% and is hydruria that is in 10%. Fever is suggestive of pyelonephritis, although approximately to 30% to 15% of patients can be febrile without having emphysematous pyelonephritis. With respect to management, 19% in the 90% patients are treated with initial intravenous antibiotics, whereas 9% are successful treated with oral antibiotics alone. The initial parenteral therapy for complicated cystitis can be fluoroquinolone, ceftriaxone, carbapenem, or aminoglucoside. The initial select antibiotic should be tolerated to sensitive according to the results of the culture. Now, regarding the treatment of this position condition, controlling the glycemic level is effective and has been found to be successful in the report case. Subcutaneous insulin injections are required. Surgery is recurring in patients exhibiting a poor response to initial medical management or those with several necrotic infections. The severity of disease determines the surgical method, the surgical debridement, and partial cystectomy, total cystectomy, or even nephrectomy in combination to EC and EP. Now, with a video.
Hello, I am Martina Fumeo and I'd love to give you a brief description of our article Emphysematous Cystitis, a review of current literature, diagnosis and management challenges. The aim of this review is to give you an inclusive and general description of this pathology in dogs with an eye to human medicine. Emphysematous cystitis, EC, is a rare disease in human as well as in veterinary medicine. In both, it is defined as an uncommon form of complicated urinary tract infection, UTI, characterized by the presence of gas within the bladder wall in the human. It must be differentiated from the term pneumaturia, which is described as the passage of gas or air in the urine. Despite its first description in human medicine in 1671, little is known about this disease worldwide. Clinical presentation of EC is variable, and patients with EC are not subject to gender or age predisposition. Diabetes mellitus appears as the most common risk factors for the development of EC, but many other underlying conditions have been mentioned in literature and should be taken into consideration. In case of EC, Escherichia coli appears to be the most common pathogen isolated from urine cultures. Urine culture and antibiogram should be performed in order to set up an appropriate antibiotic therapy, which could reduce the need of surgery, together with an early diagnosis. The prevalence of EC could be underestimated, as diagnostic imaging is necessary for the detection of this condition and for a conclusive diagnosis. It has been suggested that ultrasonography may be a more sensitive technique for detection of gas within the bladder at an early stage. Since there are no significant clinical features strongly suggestive of EC, it could be assumed that every patient presenting UTI signs, even mildly, and with a history of diabetes and other risk factors, should be evaluated radiographically and/or ultrasonographically to detect or exclude the presence of EC. Nonetheless, further studies are still necessary to better define this pathology and the real prevalence of these conditions. Thank you for your attention.
With pros and cons. We have pro. Easy can be successful treatment with appropriate antibiotics, bladder training, and glycemic control, reserving surgical intervention for several cases. The overall death rate among patients with EC has been reported to approximately 7%. Making an early diagnosis of EC and providing early treatment is essential to achieving a good prognosis. Making an early although EC is potentially life-threatening, provide an early medical intervention, including antibiotic therapy and bladder draining and glycemic control, can contribute to achieve a favorable prognosis without the need to serial intervention. Now, when comes, EC can affect the upper UT in ascending a manner and may susceptible the into EP. And delayed diagnosis can also result in a bladder rupture, overwhelming infection, and death. No significant clinical features strongly suggestive to EC have been reported to date. Preventive measures of managing EC have not been uh, established to date, and there are few ways to prevent even symptoms to UTIs in diabetic patients with asymptomatic bacteria. Now with a video.
is a case of chronic cystitis, and the bladder is measuring urinary bladder wall is measuring 10 in thickness, and you can see subjectively also that this urinary bladder wall is quite thickened with mucosal trabeculations. It is a case of chronic cystitis, 25 years male patient. Wall thickness is more towards the anterior wall and the posterior wall, and here the inferior wall is thin. This is not involved. This
Well, now, with issues applied in Ecuador. In Ecuador, emphysematous cystitis is not that common. According to the INEC in Ecuador in 2009, urinary tract infection represent the 10.3% of disease in women. The disease most commonly affects to elderly, diabetic, and immunocompromised patients. Today, there are scarce publications in the international literature and known at the national level regarding this disease in Hospital Teodoro Maldonado. There are about 49 cases so far. Well, now, with conclusion. The enzymatic cystitis is defined as the presence of gas at the level of the bladder wall or of infection cause, which may or may not have associated to intraluminal gas. The pathogenesis of this disease is unknown, probably to the multifactorial mechanisms. The clinical of this disease is not specific, so this diagnostic is made through imaging tests and mainly CT. The treatment consists of adequate glycemic control, intravenous antibiotic, and bladder drainage. The prognosis is generally good. Thanks for watching.